Next, we're going to do an active range of motion assessment for the cervical and thoracic spine. So first, I'm going to go through active range of motion in the cervical spine, and then I'm going to apply some overpressure. If an area is painful with active range of motion, I'm not going to go ahead and do overpressure because I already know that it's a problem and we need to look at it a little further. So first, I'm going to have the patient go ahead and look down for me as much as you can, just looking at cervical flexion, quality of movement, any hinge points. Next, I'm going to have you look up. As you can see, he has a lot of lower cervical flexion with the extension, so I'm going to have to cue the patient. Go ahead and bring your head back. Try and bring your neck back towards this back wall, and then look up from there. You can see a difference there. Next, I'm going to have you bring your ear towards your shoulder, looking at side bending, and then go to the other way, assessing for any difference between sides, just quality of movement. Next, I'm going to have you rotate, so I'm going to have you look over your shoulder. Again, looking for a difference, asking about pain, those kinds of things. If none of that's painful, I'm going to go ahead and do some overpressure. So I'm going to have you look down, and then I'm going to try and make a little bit of a bowing effect. I'm going to brace right at the C7-T1 junction to just really isolate that cervical movement. Okay. Next, I'm going to have him extend. Again, cueing, bring your back of your neck back towards the back wall, and then look up for me, and then applying just a slight overpressure. Next, I'm going to have you bring your ear to your shoulder. I'm going to get along here so I can get a good grasp and create somewhat of a bowing technique, and then do the opposite. As for rotation, I'm going to have you look to the right, and then I'm going to apply just a slight overpressure. As you can see, he starts to use some thoracic rotation at that point. Good. If I want to then look at upper cervical flexion and extension, I'm going to have the patient do a chin tuck as much as you can. See if that's painful, and then apply a little extra overpressure. And then the opposite extension, I'm going to have you stick your chin out, and then apply slight overpressure. As far as quadrant testing, I might have to guide them into this because they're going to extend back, side bend away, and then rotate away. So I'm going to have you bring that chin tuck position, not chin tuck position. I'm going to have you chin poke position, and then side bend away, rotate away. And then I'm just going to apply a little overpressure. Okay. Next, we're going to look at thoracic range of motion. So I'm going to have the patient cross their arms. I'm going to have them come down into the slump. He's got a lot of flexion. Then I'm going to have him come up, not so much extension. Next, we're going to sit up nice and tall. We're going to side bend, looking for quality of motion in any hinge points, and then the other way. Kind of assessing. Okay. Next, I'm going to have you rotate. Good. Asking about pain, checking for a difference between sides. Good. Then I'm going to apply overpressure if none of those are painful. What I'm going to do is I'm going to get up under here, and I'm going to have him slump down as much as he can, and then provide a little extra overpressure. I'm going to stabilize kind of near this thoracolumbar junction. Next, I'm going to have him extend. Apply that overpressure. Next, I find it easier to go like this, so I'm going to side bend him away from me and assess for overpressure. Since I find that easier, then I'm going to have to switch and side bend away from me, apply that overpressure. As far as rotation, I'm going to rotate towards me, that overpressure. Over here, rotate towards me. Now that we know that there's something going on, we need to differentiate between the various parts of upper cervical, lower cervical, and thoracic spine. So what I'm going to have the patient do to look at flexion first is I'm going to have them extend, sit up nice and tall to take out the thoracic spine, and then I'm going to have them look down and assess for pain. If that is painful, we know cervical spine involvement is the likely cause. So you can also help differentiate. If you put the patient, tell them to slump, we look at that full thoracic flexion, and then have them bring that back of that neck up towards the ceiling, and then gently look up for me. That takes out the cervical spine because it's an extension. Finally, we can look at upper versus lower cervical spine involvement. I'm going to have the patient slump down. If that's already painful, if he's holding this chin tuck position, then it's likely the upper cervical spine because this is extended. The lower cervical spine is extended. But if I have them extend out that whole, go ahead and poke your chin out all the way. And if that is painful, it's more of the lower cervical spine because this is in flexion and this is extension. Now for the opposite, go ahead and relax for me. We can look at extension. So what I'm going to have you do is slump down to take out the thoracic spine and have them just look up. That tells us if there's cervical involvement. Then I'm going to do the opposite. I'm going to have them sit up as tall as you can to induce some thoracic extension. Then I'm going to have you look down. So then we know it's probably more thoracic in nature. And then finally, I'm going to have you flex everything down, slump down, look down, and then just gently poke that chin out. If that is painful, we're thinking it's more upper cervical versus lower cervical involvement. The final test we're going to do is for first rib mobility. So what we're going to do is called the CRLF test. I'm going to control the motion, and whichever side I'm moving away from is going to be, we're testing the opposite side. So I'm going to get behind the patient. If I'm testing the right side, I'm going to take his head, I'm going to rotate it to the left, bring it down towards the ear. Good. And then you're going to compare to the two sides. You're going to rotate away, bring it down, check for a difference in motion, a stiffness, or any pain reproduction. Ta-da!